If you're going to get a tummy tuck, it's important for you to know about the recovery timeline. In this video, I'm going to break down what to expect in each week. Hello, my name is Tillo. I'm a consultant plastic surgeon and medical director of CREO Clinic. If you want to know more about tummy tuck recovery and results, make sure you check out our tummy tuck playlist. What do you expect immediately after surgery? So immediately after the surgery, in the first day or two, you'll feel a tightness in the stomach and might be either uncomfortable or can be at some stages also painful, especially if you don't take your regular painkillers. You will also get bruising in the area and swelling, which is also expected. And you'll feel, it's likely that you feel some tightness. During this early time, you'll be expected to be wearing your compression garment 24/7. You'll be restricted on having any shower, depending on type of dressing you have, and your surgeon will be advise you on that. And it's important the first few days is to take your painkillers on a regular basis, and that helps much better than taking them on and off. It's important in these early stages is to be mobile, not to be a complete bed rest, but taking it easy. So usually I advise my patients to walk around as much as they can, gently. And when they're lying down, it helps to lay on their back with slight back elevation. It's important not to sleep on your stomach, and actually it will be quite uncomfortable to sleep on the stomach, and you'll find it more comfortable to sleep either on the back or on the sides. And here what to expect in week 2. In week 2, you'll expect to have less pain in the area, so you're likely to need less painkillers. You'll be able to walk and mobilize more, might be able to leave the house and go for short walks out of the house. You may still feel tightness on the stomach. When you're walking, you may still feel the need to hunch down to avoid the tension on the stomach area. You'd still expect it to be wearing your compression garment 24/7, but you can take it off to have a shower. Normally at week 2 with my patients, they're back to having normal showers. I advise to avoid bath or of course avoid swimming, because you need to avoid any soaking of the wounds with water. So weeks 3 and 4, at this stage you'd expect to be back to your light non-physical activities, so you'll be able to go out of the house for normal social activities, non-physical activities, and might be able to go back to the office. You'll be still wearing the compression garment at that stage, but you shouldn't be doing any excessive physical activities, so no heavy lifting and still no lower body exercises at that stage. In terms of discomfort, the wound or the lower stomach might still feel uncomfortable, slightly sore, but at this stage is unlikely that you still be needing any painkillers. The stomach area can still be swollen, and it may take a bit longer time for the swelling to go down. Here, what to expect from 6 weeks and beyond. Patients at this stage are usually back to their full normal activities. They can take the compression garment off, and they can go back to exercises, gradually building up to full exercise. At this stage, there's no restriction into how they need to sleep or how they do. They can sleep on the front and sleep on the back. We expect the majority of the swelling to have settled by now. In terms of the scar tissue, at that stage, the scar might still be raised or red or lumpy. That may take a bit longer time for the scar to mature. It takes up to 6 months for the full swelling to go away, for the healing to occur, and for the scar to fully mature can take between a year to 18 months. In order to maintain the results following the tummy tuck on the long term, you need to maintain your weight, so avoid putting on excessive weight. You need to keep a healthy lifestyle, exercise, and that will help toning the muscle, toning your body. Avoid smoking, which can damage the collagen and can thin your skin, and also avoiding excessive sun exposure or sun damage to the skin, which can also affect the collagen and induces elasticity and thinning of the skin.